Many people today are told they have high blood pressure, also known as hypertension. Doctors often prescribe medication right away. But what if high blood pressure is usually not the actual disease? Instead, it is most often a symptom. It is a sign that something else is going wrong inside your body. Ignoring the underlying cause can lead to more problems down the road, even if the numbers on the blood pressure cuff temporarily improve with medication. Think of high blood pressure like a fire alarm. The alarm itself is not the fire. If you only silence the alarm without putting out the fire, the house will eventually burn down. Similarly, if you only take pills to lower your blood pressure numbers without addressing the root cause, the underlying problem continues to damage your body. True health comes from fixing the fundamental issue, not just masking the warning signs. When blood pressure rises, it is often an adaptation. Perhaps your cells are not getting enough oxygen or nutrients. The body might increase pressure to try and force blood through narrowed or stiff vessels. Once we identify and correct the primary cause, the blood pressure often normalizes on its own. For about 90 to 95% of all high blood pressure cases, the condition is labeled essential hypertension. This term essentially means that the cause is supposedly unknown. However, this is far from the truth. For the vast majority of these cases, the underlying cause is known. It is primarily linked to metabolic dysfunction, specifically insulin resistance. The fact that such a large percentage of hypertension cases have a discoverable and fixable root cause is incredibly empowering. It means that you are not necessarily destined to a life of medication and worry. There are proactive steps you can take to address the fundamental problem. One significant factor is the pharmaceutical industry's business model. This industry often profits immensely from medications that manage chronic symptoms, rather than from cures. Understanding this dynamic is not about assigning blame. It is about empowering you with knowledge. The journey starts with understanding what truly needs fixing in the first place. To understand how high blood pressure develops, we must first look at our blood vessels. Every single blood vessel in your body has an inner lining called the endothelial layer, or simply the endothelium. It is a very thin layer, only one cell thick, but its role in your cardiovascular health is massive. Think of it as the gatekeeper that controls what happens within your blood vessels. The endothelium is not just a passive barrier, it is a highly active and dynamic tissue. One of its most critical functions is to regulate the tone of your blood vessels. This means it controls whether your blood vessels constrict or dilate. When blood vessels dilate, they become wider, allowing blood to flow more easily, and blood pressure naturally decreases. When they constrict, they become narrower, making it harder for blood to flow, and blood pressure increases. This constant adjustment is vital for maintaining healthy circulation. The endothelium produces several substances, but one of the most important is a gas called nitric oxide. Nitric oxide is a powerful vasodilator, signaling the smooth muscles in the walls of your blood vessels to relax. A healthy endothelium produces an adequate amount of nitric oxide, keeping your blood vessels flexible and your blood pressure in a healthy range. Any damage to this layer can severely impair its ability to produce nitric oxide. Understanding this connection is key to understanding the most common cause of high blood pressure. Now we arrive at the core of the issue for most people with high blood pressure: insulin resistance. Insulin, when working correctly, helps your endothelial cells produce nitric oxide, which relaxes your blood vessels, lowering blood pressure. However, a problem arises when your body's cells, including those crucial endothelial cells, become resistant to the effects of insulin. This condition is what we call insulin resistance. Imagine insulin is like a key. Its job is to unlock the cell doors to let glucose in for energy. With insulin resistance, the locks on these cell doors become rusty or damaged. The pancreas then tries to compensate by producing even more insulin. So you end up with high levels of insulin in your blood, but it is not doing its job properly. When your endothelial cells become insulin resistant, they can no longer respond properly to insulin's signal to produce nitric oxide. Without enough nitric oxide, your blood vessels cannot relax and dilate as they should. This narrowing and stiffening of the blood vessels directly leads to an increase in blood pressure. The high insulin levels that accompany insulin resistance also have other negative effects, such as causing your kidneys to retain more sodium and water. This creates a vicious cycle of endothelial dysfunction, reduced nitric oxide, increased inflammation, and ultimately, persistently high blood pressure. There is another crucial layer within your blood vessels that plays a significant role in this story. It is called the glycocalyx, a delicate gel-like layer that coats the surface of the endothelial cells. The glycocalyx acts as a protective barrier, preventing blood cells and other substances from sticking to the vessel walls. This fragile layer is highly vulnerable to damage, especially from high levels of sugar in your bloodstream. When you consume a diet high in refined carbohydrates and sugary drinks, your blood sugar levels spike. These excess sugar molecules can directly damage the delicate structures of the glycocalyx. Over time, this constant assault erodes the glycocalyx, making it patchy and less effective as a protective barrier. When the glycocalyx is damaged, the underlying endothelial cells become more exposed and vulnerable to injury and inflammation. This damage impairs the endothelial cell's ability to produce nitric oxide, further contributing to high blood pressure. High sugar intake not only fuels insulin resistance, but also directly damages this critical protective lining. The good news is that insulin resistance is largely a reversible condition. Since insulin resistance is the primary driver of high blood pressure for the majority of people, addressing it directly can lead to significant improvements. The most powerful tool you have to combat insulin resistance is your diet. The key is to reduce the foods that spike insulin the most, primarily lowering your intake of carbohydrates, especially refined carbohydrates and sugars. Adopting a low-carbohydrate, healthy ketogenic diet can be incredibly effective. This way of eating shifts your body from burning sugar for fuel to burning fat. When you drastically reduce carbs, your blood sugar levels stabilize, and your body no longer needs to produce excessive amounts of insulin. Over time, as insulin levels fall, your cells can regain their sensitivity to insulin. Another powerful strategy to improve insulin sensitivity is intermittent fasting, which involves cycling between periods of eating and voluntary fasting. Combining a low-carb diet with intermittent fasting can accelerate the reversal of insulin resistance. While diet is foundational, certain nutrients can also play a vital role in supporting healthy blood pressure and improving insulin sensitivity. Vitamin D is crucial. Many people are deficient, and it plays a role in endothelial function and insulin signaling. Magnesium is another key mineral, often called the relaxation mineral. It helps relax blood vessels and can improve insulin sensitivity. Potassium is essential for balancing sodium levels and is vital for proper heart and muscle function. Ensuring adequate intake of these through diet or supplementation can be very beneficial. Beyond specific nutrients, other lifestyle factors are critical. Chronic stress elevates cortisol, which can worsen insulin resistance and raise blood pressure. Quality sleep is also non-negotiable, as poor sleep disrupts hormones and can increase blood pressure. Regular, moderate exercise also improves insulin sensitivity and cardiovascular health. It is highly recommended that you monitor your blood pressure regularly, especially when making significant dietary and lifestyle changes. Always work with a knowledgeable healthcare practitioner, particularly if you are currently on blood pressure medication, as your dosage may need to be adjusted as your health improves.